Reading was very high. I had an ultrasound which showed that my prostate was at least 3 times the size that it should have been. And so the normal progression, or the advice from the doctors, was that the next step was to be a biopsy, followed by, if the biopsy proved positive, followed by surgery and by chemotherapy. At that point, I became very alarmed. I do not like any kind of surgical intrusion into my body, and I began to look for alternatives on the internet. And this is where I found the 3D clinic and began some real serious investigation into what they were doing, and had a look at video like you are watching at the moment from other patients, got in contact with other patients, which of course brings me to the point that if any of you wanted to get in touch with me, you could do so by contacting the clinic and speaking to Alyssa, the office manager, and I will give her my absolute permission to give any of you my email address or my WhatsApp number for you to get in touch with me directly, and I will give you my confirmation of the results of my treatment. Now, I am finishing my treatment today. This is my last day today, and the results so far in a very short period of time have been, in my opinion, and of course in the opinion of Dr. Song and Dr. Ivan, really positive. So rather than try to talk to you about something that I don't really know a lot about, what I'm going to do now is I am going to read you the doctor's evaluation from beginning to end, and you will see exactly what has happened to me. Alright, so bear with me for 1 second, and we'll go through his disease history. So he's stating that I have suffered from prostate condition for many years, and that brings a very valid point, is I only discovered about it 18 months ago, but it is obvious that I've had prostate problem for many years before that. The second point which I want to make before continuing with this is that a little known fact in the Western medical environment is that mostly these prostate problems or prostate cancers will be linked to a viral infection which you've had, in my case, for a long time. In my case, I could trace my viral infection has been described as me having herpes simplex, and according to my recollection, I probably contracted that, I think probably about 40 years ago. So I've been carrying this infection in my body for a long time, and what it has created a fertile ground for my prostate cancer to evolve and to grow. And so this is a very important point, which I'll make right now about the services of this clinic, is that the approach that was given to me at the hospitals in Bangkok is to deal specifically with the prostate problem, and only with the prostate problem. Here, the approach is that they will actually deal with the entire problem. They will deal with your infection and clear it, as well as dealing with your cancer, if you have one, and hopefully also clear it. So it's an all-around treatment, and that is absolutely outstanding in terms of the result that you will achieve. So we'll continue with my assessment. When the treatment period, I started on the 14th of October, which is exactly 4 weeks ago, and today is the 9th of November, and that's the last day. The diagnosis after, when I first came here, we went through blood test. I had 8 different blood tests done. I had a saliva swab, a urine test, I had an MRI, and all of this came back to Dr. Song's desk, and his evaluation, the diagnosis was 1, prostate cancer, and by the way that was 2 tumours, a reasonably small one on the bottom right hand side of my prostate, and a rather large one on the top left hand side. So prostate cancer, benign prostatic hyperplasia, prostatitis, and prostate calcification. Now that was my case, and I would venture to say that in a lot of cases that would be pretty similar to this. I mean, varying degrees, but pretty similar. In terms of the connection between the viral infection for years before, and then the evolution of the cancer, and the problem with enlarged prostate and the presence of cancers. So the examination results before the treatment is the prostate fluid was obtained through prostate massage, and it was found that bacteria growth, namely E. coli and something called mycoplasma, were present in that prostate fluid. Number 2, there was a digital rectal examination, and the doctor found very obvious swollen prostate. Hard texture, the hard texture would be the calcification of the prostate, as well as those 2 tumors which are hardened, hardened part of what is usually a soft prostate. So that is the hard part about it. And there were obvious tenderness. What the doctor means by tenderness is that when he was actually touching the cancers, I felt pain. I felt tenderness, I felt pain. So that is a reference to obvious tenderness. And very obvious tumors can be touched on the left and the right side of the outer gland. And there is also what they call the hyperplastic nodules on the inner gland around the bladder neck. And that is the one, in my particular case, that is preventing me from being able to urinate freely. So that is also being taken care of by some medicine which I will be taking over the next 6 months to fundamentally, together with the treatment that I've had here for 4 weeks, all that combined is aimed at softening the calcification, which you are eliminating through urinating, so all that rubbish is going out of you on a daily basis, softening of the cancer nodules, and eventually they will disappear, and all of that bad substance will also be eliminated through urination. And slowly, the actual size of the prostate itself will reduce drastically back to a normal size, but a normal size for our age. That is, when we get older, we have a tendency to have a larger prostate anyway, in a healthy fashion. So there was the bacterial culture, there was the digital rectum examination, And then there was the number 3 was the abnormal blood examination results. And then were basically the viruses which was contained in my body. The first one, and the most important one, was herpes simplex virus antibody IgG. Okay, and my reading was quite high. So that means that I've carried this viral infection for years, and it has affected my energy level. I know now because I can recall from the past what it's done to me without even realizing it. You know, all of us here, including yourself, you get up some day and you feel really great, and then you get up other days and you feel low in energy. You don't know why, and one of the reasons could be that you have a permanent viral infection that is slowly eating at your well-being and creating fertile ground for potential cancer growth. So I want to really make a point of this, and that is that it doesn't matter what age you are, what I, as a layman, that is a non-medical person, would recommend that you do is get yourself tested, blood tested, even if you're 25 or 30, get yourself blood tested and ask your doctor to give you an evaluation of any viral infection that you may have. And if you have one at a young age, get that viral infection treated then. You know, try to eradicate something that may, I mean, you're young now and you're okay, but as you get older, you're becoming more prone for that viral infection to become a fertile ground for the development of cancer, probably prostate cancer. So, yeah, that, if I may be so, bold as to give some advice, I would think that this is something, if I'd known about it, I would have done it 40 years ago, okay? Get myself tested and for any viral infection, and if you have any, get it repaired, get it cured, get it fixed. Alright, so the blood examination found, I have a little bit of high blood sugar, but fundamentally the herpes is the number one enemy. And number 4, they conducted here an MRI examination. Okay, so there's a point to be made about that. Is that here, if you mention in this clinic, if you mention the word biopsy, everybody goes in shock. Okay, because it's something which is invasive, which they don't believe in, and to be able to get an absolute crystal clear picture of the presence of potential cancer is via MRI. Yeah, that will give an absolute crystal clear picture of the location and the size. And that's what they did. And the result was plain. They found the biggest tumor on the top left outer shell of my prostate, 3 by 4 by 4 centimeters. So that's a pretty big animal, okay? A tumor on the left side of the prostate, and a kind of smallish one, about 1 centimeter by 1 centimeter on the bottom right-hand side. I also had some pelvic lymph node, and that's basically it. I mean, the major point of the diagnosis is 2 tumors to my prostate. So then we go into the treatment. What has happened to me in the last 4 weeks? Well, the doctor stipulates that it takes 2 weeks to treat prostate bacterial infection through local injection, and it takes 4 weeks to treat cancer nodule and the calcification problem, that is the hardened shell in and out of the prostate, through local injection with herbal extracts. Now also every day I had intravenous drips, and it takes about 20 days. I've had 20 days of intravenous to treat viruses and cancer cells. Now, this is a double whammy. One is directed at treating the virus, and the other one is specifically targeted to treating the cancer cells. So intravenously. Okay. Now, 4 weeks of that. Conclusion. What is my condition at the end of the treatment? So through the digital rectal examination, my prostate volume has significantly reduced. That's the size itself, but the texture, most importantly. That is, before it was calcified, it was hardened, there was those 2 nodules with tenderness, it was a mess. What has happened is that the texture has become soft, and the tenderness is relieved. And I know because when I had this rectal examination, as I said before every time he touched the top left or the bottom right, I felt pain. When now I feel that there is still not a lump anymore, there's still kind of a growth, but there's no pain. And why? Is because they have cancer cell in the blood. Okay, so the condition, I'm trying to tell you. Now, it is stated through his analysis that 78 in 4 weeks, 78% of the tumor nodules have become soft. And that is the beginning of the breakdown of the nodules. And they're breaking down, they're becoming soft, and that means that they have been broken down by all of the medicine that has been injected and IV into me, and they are being evacuated on a daily basis. And again, I will state that I'm going back home with 6 months of very powerful medicine, specifically targeted as an anti-cancer treatment, and that will be the kind of the last hammer blow into the cancer cells. They will completely disappear and they will be completely eliminated. That is not just my hope, it is an actual fact. And why do I know that? It is because behind this wall here there are co-patients which are at either an early stage or a late stage of their treatment like me. 100% of them will tell you the same story. That is, they are feeling fantastic compared to the state of despair that they were in when they first came in. They, as I have, spoken to people that have been here, treatment 12 months ago, 24 months ago, people, not just yesterday, but a long time ago. We keep in touch. Okay, there is a good network done via the services of Elisa, and we have real, genuine testimonies from these people that there is only one word to describe it. They have been cured. This is not like funny story. They have been cured. So take it as you will. Call me, contact me. Contact other people that are happy to give them. You will get the same answer. Is it unbelievable? Up to you. Is it true? Up to you. I'm telling you my story and you make what you want of it. But you would be misguided not to at least investigate. If you have a cancer of the prostate, investigate. That is, do your own research, and if you are satisfied, then make your decision. But that's my story. All right. Now, obviously, we're not talking a miracle here. After the rectal examination, 78% of the tumor has become soft. However, there is a residual contour, and a shell can obviously still be touched, so that there is there still a shape. The difference is that that used to be rock hard, and now it is soft, and it is absolutely primed to be broken down further and eliminated. Now, in my particular case, the BPH, which is the condition that makes my prostate large, as well as this nodule, which is at the sort of the collar of between my bladder and my prostate, will also dissolve and be broken down in time, and that will be it's my particular problem. Okay, that I have problem with urination. I'm okay during the day, but I have problem with urination at night. He has explained to me why. I'm satisfied with the explanation, and I will very much improve within the next month or 2 months on that score. But believe me, this is really so unimportant to me. What is important to me is my viral infection, and most important, my cancer. Because you know, the cancer will kill you eventually, okay? And I'm not ready to die, I'm not a long way away. So that is I don't know, I call it really, you know, I'm the luckiest person in the world to have found Dr. Song and this clinic. The other thing I want to say right now is, as far as being welcome, as far as being in a very, very caring and nurturing environment here, you will not find any, I've been to so many clinics, you will not find any other clinics anywhere that is less money-oriented and more patient-focused than right here. They will treat you like their son, their father, their brother, you know, like a member of the family. And that is true. This is not marketing bullshit. It is true, okay? And that makes a great deal of difference. If you're coming all the way from around the world to a country that you don't know, where people don't speak English, where you're feeling isolated, most of the time you're alone, it is very good to have this kind of warm support, and very much appreciated and true. So, my BPH, okay. Many blockages and calcification as discharge. So we're talking about the calcification, we're talking about all the rubbish being dissolved from the cancer cells. All this is being discharged through urine during the treatment, which includes, of course, the next 6 months, because I'm still under treatment. So, you know, I'm not going home like a totally repaired man, and no. I will be in treatment for the next 6 months, and I'm expecting for all of that impurity and rubbish to just dissolve slowly but surely. So, and the urination, most of the time. At the end of the treatment, Mr. Martin, that's me, the symptom and spirit and overall condition is obviously improved. And then there are some recommendations. You know, the usual doctor, no alcohol, no stimulant food, and I'll pass that because that's pretty generic. So I will finish by telling you that I have Alyssa right in front of me here, my beautiful smiling face, and I will tell you that I was very nervous, like all of these people here, about some sort of Chinese doctor in the middle of the end of the world being able to repair a problem that supposedly Western medicine, which is supposedly at the tip of the technological know-how and achievement, it defies logic. It defies Western logic to say this has got to be ridiculous. You know, we have the best doctors in New York or in Paris or wherever.
Oh, does it mean